Hi, my name's Hannah Chupe, and today I'll be discussing the puzzle of Parkinson's, gut or brain disorder. But before we begin, I'd like to ask, how many people know someone who has Parkinson's disease? It could be a friend, family member, or mentor. I'm guessing most of you do. This is because Parkinson's disease is the second most common neurodegenerative disorder after Alzheimer's, and it affects over 10 million people today. But what is Parkinson's disease? Well, Parkinson's disease is a movement disorder that's always been tied to the brain, specifically the death of dopamine producing neurons in an area called the substantia nigra. This loss leads to tremors, stiffness, and the slowed movements that many of us may recognize. Most research has focused on the top down approach of how to treat the brain after symptoms appear. But recently, researchers are beginning to examine other areas, looking further into the origins of this disease. So, what if Parkinson's disease doesn't begin in the brain, but it actually starts in the gut? What if it travels up through the body before we can detect it using the vagus nerve like a highway to the brain? Let's take a look at some of the clues that have led us to believe this. The first clue came from a study in 2010 that found that misfolded proteins called alpha synuclein, one of the main indicators of Parkinson's, were showing up in the gut years before any symptoms appeared. Specifically, they found that more of these misfolded proteins appeared in patients with chronic constipation, which is a common early symptom of Parkinson's disease. This led us to believe that this protein, which may be considered toxic, could be becoming misfolded in the enteric nervous system, aka our gut, and later finding its way up to the brain. Our second clue comes from a form of inflammation. Just a year later, another study was published showing that people in the early stages of Parkinson's had gut inflammation and something called leaky gut. This is basically a condition where the lining of the gut becomes more permeable, allowing toxins or proteins to escape into the bloodstream. This then gave us the mechanism for how our misfolded proteins could be making their way into the brain, further supporting the gut brain hypothesis that researchers had devised. And then we have clue three, which is perhaps the best yet because it gives us some hope. In 2020, a pilot study showed that fecal microbiota transplants, it's exactly what it sounds like, improved both the motor and non motor symptoms in Parkinson's patients. Essentially, they found that changing the gut microbiota directly helped the brain. That's not just a connection, but that's an intervention that we can actually use. So, we found that Parkinson's disease could potentially be caused by misfolded proteins that travel from the gut to the brain. But why do we care? Why does it matter? Well, as I said before, Parkinson's affects over 10 million people worldwide. We currently can't detect it until symptoms begin, and by then, over 60% of the dopamine neurons are already gone. But what if we could find these signs years earlier in the gut? What if we could intervene before damage is done? This would be life changing for all of those people, their families, and the world overall. But this is bigger than just Parkinson's. If it's true that Parkinson's disease originates in the gut and not the brain, what does this mean for other movement disorders? How can we look at other diseases more holistically as a result? Of course, this would be revolutionary for the treatment and the care of Parkinson's patients, but it begs the question of what else we could be missing in other diseases when we don't think of the bigger picture. Just because a disease is focused within one area, for example, the brain and neurological diseases, this doesn't mean that it couldn't have other origins or connections elsewhere within the body. Could Alzheimer's, depression, or even autism have roots outside the brain? I believe that Parkinson's might not just be a brain disease. It might be a full body disease that starts deep within the microbiome and then travels silently to the brain. And if that's true, then maybe our gut holds more secrets that we could have imagined. Maybe we just started to scratch the surface. So I'll leave you with this. If Parkinson's begins in the gut, what else should we be rethinking? Thank you very much.